Welcome everyone. This is Sharon Parlier, your instructor for the Fundamentals of Health Informatics course. Today we're going to discuss Module 7, which is Ancillary Systems. These are ancillary systems within a hospital. So I hope you enjoy it, and let's get started. I'd like to start by giving you a brief overview of what we plan on covering in this module. First, I want to start by saying within any hospital there are many ancillary systems that exist, and often they interface with each other. You'll see some terms and acronyms thrown around, so let's discuss those right now. An LIS is also known as a Laboratory Information System. RIS, or RIS, is a Radiology Information System, and PIS is a Pharmacy Information System. So each of these ancillary systems have their own IS component, which we'll go into right now. Let's take an overview of what a laboratory information system is. Laboratories always function, whether they're on paper or electronically. Electronically is becoming the way of the future, and for many reasons. Let's discuss some of them right now. First off, it streamlines the workflow from requisitioning through final reporting. It also allows personnel within the lab to efficiently process patient specimens. Laboratory systems also have the ability to flag abnormal results and give ranges as well. They can also display result trends graphically in many different ways. They also help with quality control, as well as patient safety improves with easier access to lab results. Continuing on, laboratory systems help streamline the workflow in the laboratory, as I mentioned, from requisitioning right through to final reporting. It also provides multi-site, multi-facility specimen tracking. You can now see labs across the spectrum within any institution. Also, it enhances decision-making via timely alerts, online patient inquiries, and reports. Patients now, through things like patient portals, can now view their own lab results. Alerts pop up if a test was already taken. You don't want to duplicate testing. So there's many advantages to having an electronic laboratory system in place. Some other advantages of having a laboratory system in place, a laboratory information system in place, I should say, is effective communication of resulting to both internal and external care providers. You want to be able, time is of the essence when you're looking for a lab result to make a clinical decision. So when it's done electronically, this adds speed to the whole process. It's also a seamless exchange between ordering and resulting with outside reference labs. Like I said, there's a lot of interfaces in the background that take place so that when a physician places an order, the order is sent directly to the lab, whether it's internal or external, and the order then allows for the result to come back into the order and for the physician to view the result and either make clinical decisions based on that or send the result to the patient, or the results also remain on the chart. You can also monitor instrument malfunctions within the lab and laboratory testing procedure inconsistencies via quality control functionality. Labs have strict processes in place that, and they are also regulated by outside agencies. So it's very important, to have strict quality control, and any laboratory information system will aid in this as well. Some other features of an LIS system are the ability to view results in the electronic medical record or over the internet. As I mentioned, whether it's a patient portal where the results are being pushed out to by the physician, or within the electronic medical record, it's great for a physician to be able to see trending on lab results. They can see lab results across visits. They can graph them. They can see what's happening. It's it's a very excellent tool. There's also integration with other ancillary systems. Information can be sent from the lab to revenue cycle, aids in billing. You can also integrate with pharmacy leads to share clinical information, which leads to better decision making. As I said before, anything that can add to better decision making helps aid the patient within the hospital setting. And you can efficiently collect and verify specimens. I discussed this previously in the barcode module. Use of barcode collection labels. You can automatically capture specimen collection time and who the user is. Again, another tracking and audit tool. Other features of a laboratory information system include, a phlebotomist, being able to positively ID a patient. When a phlebotomist comes to take blood, they want to make sure they're taking blood from the correct patient. So using their handheld device, they can scan and check the patient's ID on their wristband. There is also the ability to place orders for past or future dates. Usually, when an order is being placed right away, but sometimes there's future orders. They know they're going to need to place a lab order for something, a week from now, or every week for the next, 6 weeks. Likewise, sometimes you need to put in an order that already went through yesterday because the order was never in there, and thus the result is not going to come into the order. You also have the ability to flag duplicate orders and evaluate order rules. This is very important. You don't want to duplicate orders. This is rising costs in healthcare is because of often many duplicated orders, and there's often rules associated with an order when something needs to be done or what order. There's also the ability to receive test results directly from the analyzers. Many in-house labs have analyzers there, and it's done seamlessly. Also, the easy access to previous test results on the patient. Like I said, it's good to, when a physician can look at a chart and see all the test results, all the lab results, and the trending that goes along with that. Another very common ancillary system that exists in a hospital is an RIS, a RIS you'll hear it referred to. And what that is, it's a radiology information system. It's a computerized database that's used to store, manipulate, and distribute patient radiology data and imagery. It often complements an HIS, a hospital information system. A RIS system integrates with an EMR, an electronic medical record, and a PACS system. Sometimes, though, when there is no PACS system, an RIS is often used to track films as well. All these systems go hand in hand. Now let's talk about some of the features of an RIS. One is patient management. Using a RIS system, you can track a patient's entire workflow within the radiology department. You can add or retrieve images and reports from an EMR. Also, it can be used for scheduling. You can make appointments for both inpatients and outpatients. It's like its own little information system. Can also be used for patient tracking. A patient's entire radiology history can be tracked from admission through discharge. History can be coordinated with past, present, and future appointments. Continuing on, I'd like to talk about some more features of an RIS. One is results reporting. An RIS generates statistical reports for a single patient, a group of patients, or a specific procedures. This is a great tracking tool and a great reporting tool. Helps on many fronts. As I previously mentioned, film tracking. Not every hospital has a PACS system. In this case, an RIS can track individual films, their archive data, and their associated data. Where are they? Next, I want to discuss billing. An RIS does facilitate billing, whether it's financial record keeping, electronic payments, claim submissions, money going out, bills going out, money coming in. It's all easily tracked. Now we're going to talk about pharmacy information systems, or a PIS. A pharmacy information system or a medication management system have several functions. inpatient and or outpatient order entry, dispensing the medications, whether they're dispensing them manually or through a Pyxis machine, inventory, as well as purchasing management. These are all tools of a pharmacy information system. They also integrate very well with an electronic medical record. You know, great for a physician to be able to see what was ordered, what the patient's taking, when it was administered. CPOE, computerized provider order entry. I've mentioned this before. This is, the wave of the future. Physicians are ordering directly online. And also barcode technology, which I've also discussed previously. Now let's talk about some features of a pharmacy information system. First off, it integrates the pharmacy with CPOE and medication charting. From the ordering to the administering, it's all there. It also streamlines and automates the daily workflows of pharmacists. Online verification work lists allow pharmacists to immediately review, verify, and fill incoming orders. Speeds up the process. A PIS also integrates automated dispensing machines, Pyxis machines, medication workstations, as I mentioned in a previous module. Most importantly, though, it reduces potential for medication errors. This concludes Module 7. I hope you enjoyed learning a little more about our ancillary systems, and I will see you on the next module.